All right, so let's go for the lumbar spine, the sacrum, and the coccyx. This is the what is left of the spine. Let's see it. There are 5 lumbar vertebrae drawing an anterior convex curvature that we know as lordosis. As you can see in this radiograph, the upper surface of the sacrum draws an angle with a horizontal that varies from 50 to 53 degrees, and this is why lordosis is necessary to achieve an upright position of the spine above. This lordosis requires certain conditions that are shown in this image. First, the anterior part of the body of L5 has to be higher than the posterior part. Also, the disc between L5 and S1, which is the first section of the sacrum, is a wedge 6 to 7 millimeters higher anteriorly than posteriorly, and this produces an angle of 16 degrees in average, although it may vary a lot from 6 to 29 degrees, which is a lot. Then vertebrae above L5, they need to be inclined backwards, all right, to achieve that upright position. The result is that the center of gravity lies anterior to the vertebral column. You see it here as a yellow line. And the spine muscles must, and also the ligaments, must assist in maintaining this lordosis. Women tend to have a greater L5-S1 angle. Elder people tend to progressively lose the lordosis, which that means problems, okay? Also, long-standing compression and wearing heels affect lordosis, as well as other certain pathologies like osteoporosis and many others. Lumbar vertebrae are the largest and the ones to support greater weights. Some of the distinctive characteristics are having a bigger body and stronger transverse and spinous processes. And this is because very strong muscles have to attach here. Also remember, there are no ribs here, so no facets for them. And have in mind that sometimes L5 may fuse to the sacrum in what is called sacralization of L5. Here you have all the lumbar vertebrae. Because the spinal cord is thicker at this as it leaves the brain, and loses thickness as it leaves every spinal nerve when descending, the vertebral foramen of the cervical vertebra must be wider, while the foramen at the lumbar vertebra is more narrow to contain just the last spinal nerve roots. Regarding the ligaments attaching the lumbar vertebra, they are similar to the ones mentioned before. So we have the anterior and posterior longitudinal ligaments that will finally insert in the sacrum. We have the articular capsules of the zygapophyseal joints. We have the ligamentum flava, the interspinous ligaments, and the supraspinous ligaments. These last two, at this level, they will resist separation of the vertebra during flexion, but only when they only tighten when at about half full flexion, and are the first to be damaged if excessive or abrupt flexion occurs. At this level, the intertransverse ligaments are a bit more complex. Those are the ones that between two close transverse processes, right? So laterally, this ligament has two layers. The anterior one becomes the thoracolumbar fascia that we will review with the muscles of the back, and the posterior one fuses with the aponeurosis of the transversus abdominis muscle, which is part of the abdominal wall, and we will review in that lecture. Medially, it has ventral and dorsal portions. The dorsal part merges with the zygapophyseal joint capsule, and the ventral one merges with the anterior longitudinal ligament. This ventral part may partially cover the intervertebral foramen, in which case different fibers may be distinguished, and these fibers are known as the transforaminal ligaments. Important because if they get inflamed, they may squeeze the spinal nerve. Not everyone has these ligaments. The most common one is the superior corpo transverse ligament, represented by line A in the image. All right, so corpo transverse means that it's going to connect the inferior aspect of the vertebral body with the transverse process of the same vertebra. Okay, the inferior corpo transverse ligament corresponds to line B, and then we have the superior, inferior, and mid transforaminal ligaments. All right, so attention to inflammation of these ligaments when you see patients. Another set of important ligaments are the iliolumbar ligaments that attach L5 to the pelvis. All right, so think this attachment has to be very strong and very stable, okay, because it's connecting the upper half of the body to the lower half of the body. Okay, there is no other attachment. Also, remember that these ligaments are only found in the adult. In young people, this is a muscular tissue that will convert into fibrous tissue. I have drawn these ligaments in this in yellow on this this is scan of the pelvis, which is 3D image, for you to understand it better. The anterior iliolumbar ligament, I think there is a, right there, travels from the tip of the transverse process of L5 to the ilium, which is the superior bone that makes up the pelvis. The superior iliolumbar ligament, which is there, now it works, also travels from the transverse process of L5, surrounds the quadratus lumborum muscle, and attaches to the ilium. Then we have the posterior ligament that goes from the posterior side of the transverse process of L5 to the ilium behind the quadratus lumborum. The inferior iliolumbar ligament arises from the lower border of the transverse process of L5 and its body, and will attach to the iliac fossa. Finally, we have the vertical iliolumbar ligament, which goes vertically from the inferior side of the transverse process of L5 to the iliopectineal line. We will review all these landmarks in the lecture about the pelvis, so make sure to come back here to better understand what was said previously. And here you have a magnified version of the drawing of the TC scan, so you can better see what we just explained. Okay, these synovial joints will permit only small gliding movement. So functionally, they are the arthrodial. All right, the zygapophyseal joints. At this level, we have three different intra-articular structures. First, we have the fibroadipose meniscoids, which are synovial folds that project 5 millimeters into the joint. They are believed to be responsible for the acute locked back, which is a very painful experience. Then we have adipose tissue pads that can penetrate the joint about 2 millimeters. And finally, the articular facets have a connective tissue rim to increase the surface area of contact. As you see in the image, the lumbar zygapophyseal articular facets are oriented in the frontal plane, so they allow for flexion and extension, but they limit a lot rotation. The last zygapophyseal joint at the L5 sacrum junction suffers quite a bit of stress and has a tendency to escape forward. To prevent this, the inferior facets of L5 are oriented in the coronal plane. All right, let's go with the sacrum. The sacrum is triangular in shape and it's a unique bone, and is the result of the merging of 5 vertebrae that become smaller as you descend in the sacrum. Sometimes S1 can be independent in what we call sacral lumbarization. Above it articulates with L5 and below with the coccyx. Laterally, it has 2 huge wings with huge L-shaped articular facets for the hip bone, resulting in the very resistant sacroiliac joints that you will learn how to adjust. It's quite common to do it. The anterior surface of this bone, as you see in the rotating image, is concave, while the posterior one is convex. Both have sacral foramina for the passage of the anterior and posterior rami of the spinal nerves. Okay, because the spinal nerve in the rest of the spine, you have only one hole among 2 vertebrae, but the spinal nerve, as it leaves the vertebral canal, it divides into an anterior and a posterior nerve. Okay, here, because the vertebrae are fused, this is why we have those holes. One hole for the posterior nerve, another one for the anterior one. Here you have an anterior view of the sacrum and a posterior view, which has more accidents because aponeurosis and some muscles attach here. Here you have a superior view and a lateral view showing the articular facets of the sacrum. And the last one is the coccyx. It is quite simple and represents an old tail we used to have. Its only function is to provide a bony anchor to several muscles and ligaments of the pelvis, although those are important. I heard a case of a young man that broke the coccyx and fool of the surgeon decided to cut it off, and you can't imagine the problems that derive from that. Okay, its structure varies between the 3 to 5 fused vertebra, and it articulates with the sacrum by its horns, but it can also be fused to it, forming just a bone. Last, here you have a picture of the coccyx. All right, so thank you for listening.